Thank you, Minister. And I have been made aware of a huge crisis in the dental public service. Along with others, the Irish Dental Association have been calling for additional funding and more resources over, I suppose, many years now. There are massive issues in the system with public care, and our nation's dental health is suffering. Minister, I met with the HSE chief last week and he told me that he specifically did not add dentists into the moratorium. So active recruitment is ongoing, but there are not enough dentists to fill the roles. So we really have to look at a focused discussion on this and find a solution. In County Carlow, there is, I've been talking to so many primary schools, and there's huge issues with children being assessed. One school has told me that they have never had a referral to the public dentist. The current dental clinic in Carlow is actually closed at the moment for refurbishment. There's just one dentist covering the entire county, with just 2 clinics, Tullow and Bagnallstown, available due to the pandemic. And I think, in fairness, Minister, I do understand that the pandemic has played a huge role in this, but children who would normally be seen in 2nd and 6th class are not being seen now until 4th class and 2nd year of secondary school, and really that is a huge issue. They are missing their checkups at essential dental development milestones. Many of the children who age out of primary school model of care, so they're dependent on their parents' means to get them to a dentist and pay for it. In some dental practices in Carlow, it is even very hard for a person with a medical card to get signed up with a practice, as a large proportion of dental practices are simply refusing to sign up new patients with a medical card. And we all know that a significant number of contracted dentists across the country have withdrawn from the dental treatment service scheme. And I know, Minister, you are really aware of this. Recently, I had to actually PQ a list of those dentists still in the scheme in Carlow. So if people came into my clinic, I wanted to be able to tell them what dentist. And that's very hard, because what came back is 1 dentist in Carlow. Are you okay? Sorry. Yeah, okay. So, Minister, one dentist in Carlow. Good dental hygiene is essential for all people. Most oral health conditions are largely preventable and can be treated if there's early stages, but we are not getting that. And another area, Minister, is more people I'm talking to, they're telling me that they're actually travelling abroad for dental care because they feel our system is broken, and that is worrying, so it is. And I just want to ask about the existing medical card entitlements that are very limited in terms of what care a patient is entitled to, if they even can find a dentist, as I said. And if you, sorry, will I continue, or you, yeah? Oh, yeah, sorry. If you look at the area of orthodontic care, it is so expensive in a private practice. And again, the medical card programme only covers patients with front teeth problems. So the medical card does not cover molars, which are one of the most important tooth a person's mouth, being used particularly for chewing food, Minister. You know that yourself. Look, there's huge issues within the system, Minister, and it is worrying, and I know this is across the country. And as I said, to make sure that our young children are getting assessed at an early age in primary schools, I believe, is crucially important. Thank you.
Thank you. I'm taking this debate on behalf of the Minister for Health, Deputy Stephen Donnelly, and I wish to thank Deputy Murnane-O'Connor for the opportunity to address the issue of expansion of dental care for patients and increased fees for dental contractors. The Dental Treatment Services Scheme provides dental care free of charge to medical card holders aged 16 and over. Services available annually and on demand include an examination, including preventative advice, 2 fillings, emergency extractions, and a scale and polish. More complex care, such as dentures and a broader range of treatments for patients with additional needs and high-risk patients, are available subject to HSE approval. In May of 2022, the Minister for Health approved measures providing for increased preventative care and increasing the fees paid to dentists for most treatments items by 40 to 60%. Fees paid to dentists for the DTSS care are aligned with other European countries which provide comparable public dental care. The number of patients and treatments have been increasing since the measures were introduced. Comparing the claims made by the DTSS contractors nationally from January to October 2023, 142,450 additional treatments have been provided under the scheme, with over 25,600 extra unique patients treated when compared with the same period last year. However, the Minister is aware that medical card holders in some areas continue to have difficulty accessing care. Where access to a dentist is difficult, the local HSE service will make lists of DTSS contractors available to medical card holders. In exceptional circumstances, the HSE assists patients in accessing emergency dental treatment by directly contracting private contractors and arranging treatment to be provided by HSE-employed dentists, and additional funding was made available to HSE this year to provide this care when required. For children, the HSE Public Dental Service provides screening and necessary treatment for children at ages corresponding to 2nd class, 6th class and, subject to capacity, 4th class. Emergency care is also provided for children up to 16 years of age and for those with complex and additional needs. The HSE is continuing to restore dental screening and treatment to children up to 16 years of age through prioritising clinical treatment in patient groups and reallocating clinical resources according to greatest need. In the longer term, the Minister for Health recognises that oral health care for all ages need to be modernised in line with best international evidence and practice, as set out in the National Oral Health Policy, Smile agus Sláinte. The work is already underway for children aged from birth to 7 years using €4.75 million funding awarded in Budget 2023. The modernised services will be person-centred, prevention-focused and available locally, in line with the vision set out under Sláinte Care. The Minister has supported the HSE to develop clinical leadership and reform leadership roles to progress implementation of the policy this year, and the HSE has recently appointed a strategic reform lead to drive policy implementation across the organisation. This will enable HSE to move forward in 2024 with developing new services for both adults and children in line with the policy. Thank you.
Thank you, Minister, and I welcome the appointed strategy reform to lead and drive policy, and I do welcome that. But, Minister, we have a situation where there is children going in secondary school that haven't been assessed, and that is a huge issue. There's parents out there that just don't have the money to bring their children privately to a dentist, and while we only have one dentist in Carlow that covers, like Carlow now in the last census, the population is over 62,000, which is, you know, we are growing and we're delighted to be growing. But with that, Minister, is bringing challenges. And I do know that you will go back to Minister Donnelly and you will highlight my concerns that we just need to make sure that children are seen in primary schools when they are meant to be seen. Another issue came up about the medical card and about what the medical card will cover when you go to the dentist. And I think that needs to be looked at too. I do welcome that you are looking at a system. I think you need to change that. But another area that I believe needs to be looked at, and we need to totally reform the dental tax relief scheme, the Med2 form, to increase the tax relief to a minimum of 30%, expanding access to treatments and reliefs available, and make applying for it more simple and relate to the ongoing health of patients, including extractions, filling and hygiene treatments. Minister, just separately, and this is just something that needs to come in on this, because a lot of people have come to me about this, separately you might look at the tax acts which have not been consolidated since 1997. We really must take this into account because of the challenges, and we've seen what has happened over the last few years. So it's 26 years since this has been looked at. I would ask that you look at this. Minister, I know that you're aware, I know Minister Donnelly is aware of this, but we have huge challenges across all our health sector at the moment. But I have families coming to me and their children are in primary school and they just at the moment can't access a dentist through the public health. So maybe, Minister, you would look into that. I know you will, and I need to maybe, if you would come back to me with answers on this, I would really appreciate it. Thanks, Minister.
Thanks, Deputy. And I have listened to yourself and to colleagues in the Chamber and have taken on board the points that you've made. And I can assure you that addressing access to dental care, including for adult medical card holders, is a top priority for the Minister and the Government. The Minister has made substantial additional investment in oral healthcare services both in 2022 and in 2023. Fundamental reforms are also being progressed through implementation of the National Oral Health Policy, for which funding has been provided this year. The policy sets out the vision for the future of oral healthcare services. While it will take a number of years to bring to complete fruition, there will be an early and continued emphasis on addressing current access issues. The policy fundamentally aspires that all Irish people will have their own dental home, where they build a lifelong relationship with local dental practice or practices of their choosing for continuity of care from birth to old age. The policy has two goals: to provide the supports to enable every individual to achieve their best personal oral health, and to improve access to dental care in an equitable and sustainable manner, therefore enabling vulnerable groups to improve their oral health. I am confident that working together with the dental profession and all stakeholders, the goals of the policy will be met.